Today, you will learn how to tell if you're living in mold, because mold exposure is one of the most overlooked root causes of chronic illness. And if it's affecting you, missing it can keep you stuck for years. Welcome to my channel. I'm Dr. Jaquel Patterson, naturopathic physician, functional medicine expert, helping people recover from chronic complex illness. In this video, we'll cover 5 critical steps. Number 1, the symptom patterns to watch for. 2, the environmental red flags. 3, how to test your home and your body. 4, what to do if exposure is confirmed. And 5, how to support recovery from a naturopathic perspective. So if you're dealing with unexplained symptoms, this topic may be one of the most important you'll ever learn about. So step 1, symptom patterns. Mold exposure doesn't always look like a classic allergy. It can present in many subtle ways. The most common patterns I see include respiratory symptoms, like chronic sinus congestion, new asthma or worsening asthma, frequent infections, persistent cough or throat irritation. Also neurological symptoms like brain fog, poor concentration, migraines or headaches, light sensitivity, wired but tired feeling, and fatigue and sleep issues, unrefreshing sleep, waking up but feeling tired, insomnia, fatigue that doesn't improve with rest, crash after being in certain environments, and also mood changes like irritability, mood swings, anxiety, depression, heightened startle responses, emotional overwhelm, and also gut issues like IBS symptoms, food sensitivity, frequent infections, and also autoimmune flare-ups. You'll also see issues with pain potentially, like muscle aches, joint pain, fibromyalgia-like symptoms. And if you have multiple symptoms from different categories, mold should be on your radar. So if many of those symptoms you have, definitely consider mold in your radar, in your workup. So step 2, environmental red flags. One of the strongest clues is whether your symptoms correlate with your environment. So look for these red flags: musty smell in the home, visible mold or water stains, past water damage or leaks, high humidity, condensation on windows, basement or crawl space issues, and feeling worse in certain rooms or buildings or certain times of day. Also feeling worse during certain seasons, particularly with more humidity. If you notice a pattern where symptoms flare in one location and improve when you leave, that is a major sign and something I've seen clinically with many of our patients. So step 3 is also testing your home and body. You want to do testing like air sampling, surface sampling, ERMI testing, moisture meters, professional mold inspection to identify mold presence, hidden leaks, and also high humidity areas. Also, in terms of physiological testing, mycotoxin urine testing, mold antibody testing, immune markers, inflammation markers, detox, and genetic susceptibility. Not everybody needs every test, but you do absolutely need a plan. And what do you do if exposed? The most important step is actually removing the source, because if you remain exposed, no amount of supplements going to fully heal you. So the remediation should include fixing leaks and water damage, removing contaminated materials, reducing humidity, improving ventilation, using HEPA filtration and dehumidifiers, and possibly considering relocation temporarily if symptoms are severe. Mold is a root cause that requires a root level solution. In terms of naturopathic recovery, you want to look at detox support, including helping to support the liver, bile flow support, binding agents, and gentle sweating as well. And also gut healing protocols like probiotics, anti-inflammatory diet, and nutrition, as well as supporting any symptoms of gut dysbiosis. You may also need to help with nervous system and sleep, so stress regulation, nervous system support, sleep restoration, and nutritional support as well. So you want to go beyond basic supplements. You want to make sure you support your detox pathways, you reduce inflammation, you support methylation and antioxidant capacity, and also know that this is not a quick fix. It's really a system reset. So if you're struggling with chronic symptoms and you notice patterns tied to certain environments, certain times of the day, certain seasons, mold exposure is worth investigating. And mold is a hidden root cause that can get people stuck for years until it's addressed. If this was helpful, please subscribe so we can continue talking about root causes and integrative medicine strategies for complex illness, and check out part 2 where we dive a bit deeper into mold treatment protocols, testing, and strategies.